Now let's review the 6 rights. The first right is the right patient. Each hospitalized patient wears an ID band on which his or her name and other identifying information is written. Every form in the patient's chart has identifying patient information on it. The patient's name is cross-checked when first transcribing the order from the order sheet to the MAR. Additionally, the patient's ID band is checked before administering any medication. This is a critical step and must not be skipped. But even checking the patient's ID doesn't guarantee a medication administration error will not occur. JCO specifies that 2 patient identifiers must be used prior to medication administration. This can be accomplished in a variety of ways. If the patient can communicate verbally, the nurse can ask him or her their name and birth date.
Okay. September 5, 1915.
Very good.
Sometimes a nurse will physically take the MAR into the room and check the patient's ID band against the identifying data on the MAR. In some facilities, nurses vend medications from automated dispensing machines. The machine then prints a receipt with the patient's name and a list of the medications. This can be taken into the room to compare against the armband or the patient's stated name and date of birth. The second right is the right medication. There are multiple checks related to this right. When preparing to administer a medication, the nurse reads the MAR 3 times. First, the nurse reads only the MAR. Second, the nurse removes the medication from its container and cross-checks it with the MAR. Check the drug expiration date on the medication label. Do not administer medications that have expired dates. And third, the nurse again cross-checks the MAR after administering medications to the patient before discarding the container. Administer only those medications that you or a pharmacist has prepared. Never agree to administer medications to a patient that may have been prepared by someone else. If the medication order doesn't fit what you know about the patient and their diagnosis, stop and double-check the order and make sure you have the right patient. Examples of medications that make sense are Lasix for someone with congestive heart failure, Avandia for someone with diabetes, and Lotensin for someone with hypertension.